I am incredibly focused on working with our providers and our community organizations to find ways that we can use the funding we do have in more creative models to get everyone sort of practicing at the top of their level or capacity in a way that kind of lifts the system as a whole overall. So, there's been some great examples of this in different areas where we've invested kind of upfront in some of our home and community workforce staff, enabling them to really be our frontline sort of monitoring system to alert us and let us know when there's a change in someone's condition or something that may have been unexpected or just something they've observed that was different. But it allows us to respond more proactively and faster to ensure that those individuals are getting the care they need and avoiding a more costly utilization episode or acute care episode. And so I think, one of the areas that we're really focused on is figuring out how we can bring different stakeholders together, whether that's providers or community groups, direct care workforce agencies. Our goal is to work with those organizations early on in sort of crafting these models. There's usually not an issue with the plan that somebody leaves a episode of care with. It's when they get home and they're in that community setting that things don't always go as planned. And the community health workers are really helpful in not only creating sort of that continuity and making sure that what we anticipated happening is really what's happening every day, but also just being out in the community and helping individuals understand how to access care, when they need to access care, where to access care. We also have a training program for our Medicaid members that actually are interested in a healthcare career, and we will pay for them to become a community health worker. And so we have had some members that have taken advantage of that program, and they are now community health workers. And they may not come work for Aetna, but they're going to end up working for somebody as a community health worker.